Hello, I'm Dr. Jeong, work at Seoul National University Bundang Hospital in Seongnam, South Korea. Well, first of all, on behalf of ulcers, I really appreciate Korean Journal of Urology editorial team for invitation to the video interview of this study. We have received an Excellence Award with this research in the last annual meeting of Korean Urological Association. In this study, we investigated the etiology of LUTS and compared the urodynamic characteristics between different diagnostic groups in young men with chronic LUTS who had not had symptoms suggestive of chronic prostatitis. Although chronic LUTS is not uncommon in young men, it has received little scientific attention. As the incidence and clinical implications of each urodynamic etiology among chronic LUTS of young men remain largely unknown, making proper diagnosis and management of each condition is challenging for relevant physicians, and these young men frequently experience the recurrence of symptoms in spite of various medication. So, chronic LUTS in young men often pose a diagnostic dilemma. Obtaining a clinical diagnosis on the basis of a history of symptoms and physical examination alone is often not possible for chronic LUTS in adolescent and young men. We reviewed the medical records of over 300 men aged 18 to 50 years who had undergone a urodynamic study for chronic LUTS more than 6 months without symptoms suggestive of chronic prostatitis. Findings of urodynamic testing were classified as storage and voiding phase abnormalities. Primary bladder neck dysfunction, dysfunctional voiding, detrusor underactivity, and acontractile detrusor were considered to represent voiding phase dysfunction. And detrusor overactivity, small cystometric capacity, and reduced bladder sensation were considered as storage phase disorders. During the process of urodynamic reviews, it may be important to interpret the specific urodynamic findings for the accurate diagnosis. So, the urodynamic diagnosis was determined based on the retrospective interpretation by the two investigators who had blinded to the patient clinical characteristics. Mean age was 40 years and mean duration of symptom was 39 months. This slide shows the urodynamic diagnosis categorized by voiding and storage phase dysfunction in older patients. Voiding phase dysfunction were in 62% of cases, primary bladder neck dysfunction in 26%, dysfunctional voiding in 23%, and detrusor underactivity or acontractile detrusor in 13%. A single storage phase dysfunction were in 36% of cases, detrusor overactivity in 13 cases, a small cystometric capacity in 18%, and reduced bladder sensation in 5%. Of the total patient, 26% had normal urodynamic findings. The incidence of primary bladder neck dysfunction was highest among those in their 30s, and that of detrusor overactivity among those in their 40s. In addition, small capacity was more prevalent among men under 40 years. Most of the demographic characteristics and clinical symptoms did not differ between these diagnosed groups. 54% of patients with voiding dysfunction had storage dysfunction. Men with dysfunctional voiding or detrusor underactivity, acontractile detrusor, exhibit lower maximal cystometric capacity than those with normal urodynamics. Low bladder compliance was most frequent among patients with primary bladder neck dysfunction. About 70% of men with storage dysfunction had voiding dysfunction. In storage dysfunction, men with detrusor overactivity exhibit higher detrusor pressure during voiding than did those with other storage dysfunctions. In this study, several limitations should be considered: retrospective design, selection bias, urodynamic diagnosis without concomitant video image, and single center experience are all considered to interpret our imaging. Well, I should like to end by saying this. We recommend that it is essential to perform urodynamic evaluation to investigate the possible etiology of LUTS in young men with chronic LUTS, especially those with refractory symptoms. A high index of suspicion for possible etiologies for LUTS may be important for accurate and timely diagnosis of treatable LUTS in young men. Thank you once again for invitation, support to our study.